All right. Well, hello and good morning, everyone. And thank you for joining us today for this month's installment of the guest speaker series here at Climate Farm School. Let's see. So for those of you who don't know me, my name is Claire Hambrick, and I'm the program manager here at CFS. I oversee this guest speaker series and continue to be very excited and inspired by the amazing food systems changemakers that generously donate their time to facilitate this online gathering of our alumni and CFS community. So today I'm delighted to introduce Dr. Mary Lesser, who wears many hats. She is a professor in the Nutrition and Metabolic Biology Department at UC Berkeley, a pediatric sports dietitian at UCSF Children's Hospital, and VP of Public Policy for the California Academy of Nutrition and Dietetics. Mary also happens to be my former professor and honors thesis advisor, so it really is a treat to get to hear her speak again. And without further ado, I will pass it on to you, Mary, to speak on designing equitable food systems and food policy landscapes.
Thank you, Claire. And thank you so much for having me today. I was delighted to come and speak to this audience, and I got very excited in putting together this talk. So hopefully I didn't get too much information in there, but please don't hesitate. I don't know if there's a particular format, Claire, but don't hesitate to drop a question in the chat or put your hand up if you do have a question, or you can save them all to the end as well. I do drink a lot of coffee and not sleep that much, so I often talk quite quickly, and Claire can attest to that, being in my class for a semester. So if I fly through something and you need me to backtrack a bit, please, again, don't hesitate to ask me to stop. I'm more than happy to. Okay, so without further ado, I'm happy to get started. So what are we going to cover today? So Claire mentioned a couple of my positions, and yes, I do wear many hats. Primarily, I'm at UC Berkeley as a professor, and I actually oversee all of the capstone research and the research efforts for a graduate program there. So a lot of my background is primarily in kind of more classical training and research, but as a clinician, I have that kind of one-on-one touch point with patients, and I've worked with a variety of patients. And although right now my primary patient population is athletes, I have worked with other patients, primarily pediatrics, where a lot of our food and nutrition policies like very heavily impact their either access to foods, their ability to be able to choose certain foods depending on where they live and such like that. And so I feel like through that kind of more clinical lens, I've been able to take my research and then add on this piece in terms of understanding and being more active in the policy and advocacy setting to kind of bridge those together, the research and the policy, to help provide more translation of ethics to maybe potentially influencing policy, helping to influence policy, or what have you. Because at the end of the day, that's what's really shaping how my patients, how different communities, individuals, what have you, are going to be interacting with the food system, foods, what have you, that they in their own neighborhoods. So what was kind of unique and fun about putting together this lecture was that I was able to really try to flex kind of the different hats that I wear and really see where they all kind of intersect together. And one of the things I always tell my students as well as colleagues now, because I know I was this way definitely as a college student, even as a grad student, that policy used to scare me, and that it was something that other people like participated in and other people did, and that I may have done some of the research part of it, may have helped patients, maybe followed policies, but I wasn't the one that was going to be influencing, engaging, or what have you in the policy making process. And I've really come to find out, and have kind of put this as kind of a new mission over the last several years, of that that's just not the case. Any of us, clinician or not, policy is us. And being a part of any policy and advocacy efforts is huge, because policy is what sets the stage in how we kind of interact in our different systems. And so one of my kind of objectives in being and in taking on the role of VP for Public Policy for California Academy is to really help change that kind of mindset around policy being scary, and participating in policy and advocacy activities, and really showing people that you can be engaged, and you can be engaged and participate at any level. So I'm hoping today that you you all will take that away from you as well. Some of you in the audience may be super already heavily involved in policy, which is awesome. You may be way more involved than I am and know more than I do, which is great because I love learning from, would love learning from you all as well. So for today, what are we going to talk about? So my lens is going to be coming from very much the nutrition aspect, but obviously nutrition involves food. So a lot of my lens is kind of the, intersection of taking food and nutrition and putting it into the health context. And so I'm going to be kind of more focusing on that. I tried as best as I could to. There's a lot to cover in food and nutrition policy in general, and then also taking a look at just the California food and nutrition policy landscape. So I tried to narrow down as best as I can to focus in on, some childhood nutrition initiatives as well as food as medicine initiatives. Just know that there's many more out there, but I tried my best to try to focus in on those. So today we're going to start off by framing the issue a little bit around kind of why policy is important, why building food systems that are both equitable and sustainable are important, how California fits in as a natural leader with what we're doing now. That doesn't necessarily make us the best. It doesn't make us the worst. It makes us somebody as a state that really takes pride in the initiative of being that leader, but there's always room for improvement. And that's the one thing about policy I hope we also walk away with today is that there's always the opportunity to improve because we're always, the landscape is always changing. So we're evaluating and we are flexing in or on or off or what have you and updating our policies based on that. I will focus in a little bit more on kind of the California's food policy landscape, focusing in again on that couple of childhood nutrition initiatives as well as some food as medicine initiatives. And then I did want to bring up just some relevant legislation, both recently passed, not too long ago, but ones that tie into some of these initiatives I'll bring up today, and also some current, more relevant legislation that do really tie into these efforts around, building a more equitable and sustainable food system. And then hopefully I will be able to provide some very general, my thoughts on how to kind of focus efforts in terms of building equitable and sustainable food systems, no matter where the food system is in the state of California. I will provide a little bit more of a California focused lens, but you can still take those principles and apply them out of the state or even within the own local food system or multiple food systems that you might interact with or you have colleagues or that you, conduct your own professional and personal work in. And then I do have 1 to 2 summary slides and a lot of action items, basically resources for anybody who's interested and wants to learn more. All right, so framing the issue, we're going to talk a little bit about the role of food and nutrition policy. All right, so for food and nutrition policy, why does food and nutrition policy matter? Well, food and nutrition policy does play a pretty critical role in addressing health disparities. We'll talk about those in just a minute, by really helping to create frameworks that promote equitable access to nutritious, affordable, and culturally appropriate food. Basically, food access or the ability to have access and be able to acquire food is going to help shape health outcomes, well-being, as well as just social equity as well. I know the terms of food secure, food insecurity come up quite often when we're thinking about food policies, especially around equity. Food insecurity are those that are food insecure, meaning they don't have access or they don't have regular access to not only the quality of food, but quantity of food, appropriate food. They aren't able to obtain their food in an appropriate way. There are multiple different components to what goes into defining if somebody is at a certain level of food secure or insecure. But we know that food insecurity does disproportionately affects certain populations. And by focusing our efforts on building equitable and sustainable food systems, this is helping to address those inequities, to help promote fair access, sustainability, as well as resilience in terms of all individuals being able to, obtain health, through having access to healthy and nutritious foods, right? So how can food and nutrition policy play this role? Well, it can be accomplished through several different ways. And I'm going to go through these hopefully quickly. So the first one is that food and nutrition policy can help enhance food security. So I just mentioned a little bit about food security. Some examples about how this can be done. So programs like, for anybody who has ever heard of CalFresh, also known nationally as SNAP, or the Supplemental Nutrition Assistance Program, as well as WIC, Women, Infants, and Children's, are policy and federal programs that help provide targeted assistance to low income families. And this really helps reduce the barriers to accessing healthy foods. Both of those two programs are very, probably you've heard them in the news, maybe you've experienced them personally yourself, maybe you experienced them in the work that you do. They are two very different programs, but they are food and nutrition programs that are helping to increase that access to food, done two completely different ways. And for the most part, different populations. I mean, if you are somebody who is enrolled in the WIC program, you can also be enrolled to receive SNAP benefits or CalFresh here in California. If you're enrolled in SNAP, you can't necessarily be enrolled in the WIC program. There are certain ages as well as populations for that. But regardless, these are two initiatives that help increase the access to healthy food, either by providing cash benefits as well as healthy food packages or vouchers to be able to purchase or acquire healthy foods. Another example of a federal program that you see nationally, but we absolutely have here in California, is Universal School Meal Program. I will be talking about this one quite a bit. It falls under our childhood nutrition initiatives that I bring up in terms of our California food landscape. The Universal School Meals is a unique policy. Here in California, we're the first one to enact free school meals to ensure that all children, regardless of socioeconomic background, can receive nutritious meals. Right? The second way that food and nutrition policy can play a role is through promoting community health. Again, I will be diving a little bit more deeper into this, but some of that can be in the form of food as medicine initiatives. And when I say food as medicine, this is also kind of a big hot topic word that comes up quite a bit. You're hearing it a lot more on the national level. California has been, pursuing and working on integrating more food as medicine initiatives for quite some time now. The ones that I'm going to be talking about a lot are the medically tailored meals. So these would be policies that are working on integrating medically tailored meal programs into healthcare systems to address nutrition-related chronic diseases. So basically using like nutrition, in the form of specific meals or from that dietitian's lens, medical nutrition therapy to be able to help address chronic diseases. So using, again, hence the food as the form of medicine, not necessarily to completely negate medicines, because there are some diseases that do require, the use of medicines, but the hope is that many of our chronic diseases have food and nutrition can have a real impact on, halting progression, reversing outcomes and such like that. Another example for promoting community health is through incentives for local and healthy food access. So for example, grants and subsidies to encourage retailers in underserved areas to stock fresh produce and healthy foods. One of the most successful ones of recent years is the healthy refrigeration policies by providing like grants to be able to have to give to smaller businesses that might be in a food desert or sometimes known as a food swamp, to be able to purchase and sell fresh produce where by being able to afford and support the equipment needed so that the shelf stability is longer. All right, a few other ways that you see how food and nutrition policy can play a role. One, in supporting equity in food production, so helping to empower underserved farmers, initiatives such as grants for small-scale farmers, to promote diverse and inclusive agricultural systems, ensuring equitable participation in food productions. Also, we have the healthy soils and regenerative agriculture. I think that Climate Farm School knows about this one very well. And if you've taken this, been part of this course or this organization, I don't need to say much more about that. But again, really helping to support, outside of what we may traditionally think as farming practices, so that we can boost local food security while addressing the climate resistance as well. We want to incentivize these practices and help support different farming practices. Next, encouraging sustainable and inclusive food systems. So one that I'll bring up a little bit more in depth is our farm to school programs that California has been a leader in for the past several years. And some of the legislation that I will be bringing up does help continue to support the farm to school programming that we've had in our state. And also urban agricultural programs as well. So initiatives to really connect schools, which is why I'm bringing up on some childhood nutrition, schools and urban communities with local farms. So we're helping to ensure fresh and culturally relevant food is available while also fostering education opportunities about sustainable practices. And then another one is reducing food waste. And we have this really great policy and pretty innovative policy. As it was from Senate Bill 1383 here in California, which mandated food recovery to help redirect surplus foods to those in needs, addressing hunger while reducing environmental impact. So it's pretty innovative. And again, I know, as I mentioned this before, California has taken the lead on many of these very interesting and new policies to really address some of the inequities that are seen among different food systems and different populations. And then finally, addressing cultural relevance and accessibility. So this is helping to support the inclusion of cultural foods in nutrition assistance programs. So making sure to incorporate culturally significant foods into the programs to ensure that diverse communities can access and utilize these resources effectively as well. It's one thing to be able to provide food, but it's another thing to be able to provide food that is, not only culturally, but maybe even medically, relevant to those who need the access to that food and would benefit for that to help with their health outcomes as well. And then finally, community participation in policy development. So really engaging all communities, especially those that are at higher risk of health disparities or of facing those injustices or inequities to being able to access food. So really engaging them and having them, very integrated into the policymaking process to really help foster more inclusive solutions that are going to be sustainable to meet the needs of those populations. All right. So moving on. So I just talked about a lot of great things for what we focus on, why it's important to have food and nutrition policy, how it can really help with starting to really think about this, dynamic between helping to create and sustain these food systems that are equitable. However, equitable and sustainable food systems are very complex. And there are multiple items or according to these authors, they call them discourses that can shape your equitable food systems. And oftentimes it is through these discourses that we need to navigate as groups, as policymakers, as concerns, constituents or what have you, collaborative partners. We need to really navigate the tensions that come up between the competing discourses and really employ a democratic process so that, again, we're focusing on, crafting policies or supporting policies that are inclusive and helping to balance the diverse priorities so that equity concerns are addressed holistically and not necessarily biased from one way to the next. And what are the major discourses identified or that have been identified in terms of helping to shape equitable food systems? There are four, they can kind of be categorized by four major discourses. The first one being productionism, which is the focus on maximizing agricultural efficiency and yields. And so solutions tend to prioritize technological advances and market-driven strategies to reduce costs and improve access. And the next discourse is redistributionism, so centering on redistributing resources and wealth to address disparities. Anti-capitalism, critiques the commodification of food and systemic inequalities perpetuated by global capitalism, and finally, aid-based approaches to rely on charitable models to provide immediate relief for food insecurity. So these are the four major discourses that we're keeping in the back of our mind. And as you can imagine, depending on location, depending on population, depending on, the need of or the availability of what's in those particular areas, the food system can be, can be stretched one way or leaning one way or the other through the four of these, major discourses. And so the hope and the goal is to work, on taking a look more holistically and seeing where these discourses intersect and can work and support, work together in terms of that whole goal of building a more equitable and sustainable food system for all. Yes, I got a question in the chat. Can I explain redistribution more? Yeah, absolutely. So, so again, just as like a kind of a basic centers, so redistribution centers on redistributing resources and wealth to address disparities. So essentially taking a look at what disparities may be more prevalent in a certain food system, population, community, wherever we're taking a look at, and seeing where we can redistribute where some of those resources are kind of more heavily like piled up, what have you, maybe not being used as much. So this would be, for example, like advocating for policies like subsidized food programs, support for smallholder farmers, universal school meals. So again, depending on the situation. So for example, maybe you're in a community that has, smallholder farmers, not as much of the, large scale production farming practices. So advocating for policies that would, help to support like those grant programs or the farm to school programs that would help support those smaller scale farmers, and also to be able to bring in, still meeting the needs of those systems, like let's say the childhood nutrition and such like that. So again, taking away. Does that answer your question, Jenny? Oh, awesome. Great.
Thank you.
No, absolutely. That was a great question. Yeah. All right. So really at the, goodness, got a little excited there. So really at kind of the end and thinking about the complexity of, it's nice to say food policy, nutrition policy can do A, B, and C things, but it's one of those a lot easier said than done. And one of the things, and I'm sure Claire can remember me saying this too when we were talking about policies in class and such, is that even the best policy, even if we're trying to be as inclusive, as far reaching to meet all the needs of, wherever the policy is going to come into play, there's always some sort of unintended consequence. Sometimes that can be positive, which is the best outcome. Sometimes that could be negative. And so, what I would say to anybody who has had any wants to have any more experience in policies is to always try to poke the holes, and really start to put that critical lens of, if we want to include this aspect into the policy, is it taking away or causing stress, or is it going to like bump up against, one of those other discourses that would, be now not, meeting their needs or meeting what like that goal would be of, addressing that discourse. And oh, Maria, this is a great question. I just saw your question come through. I'm going to save this one towards the end a little bit, if that's okay, just because I would love to have a kind of a more one-on-one conversation of ideas of how to be more involved in your own community to have these conversations, because I feel like that's the scariest part. So I love that you are asking this. Okay. All right, so moving on, just wanted to give that, like, kind of a more deeper dive look into California. I am not sure if those who are in the audience, if you are California born and bred, if you are from outside the state or even outside the country and are now in California, You know, I was born and raised in Northern California. I moved to Boston for a few years. And when I was there doing my training, everybody was like, whoa, you're from California. You're that crazy state on the West that's always doing all those crazy things. And in a positive light, but also like, oh, you guys are just so wild west out there. And you know, in some aspects we are, but I think that, you know, makes, you know, the state pretty unique and pretty amazing is that we've always been a unique and natural leader in many different aspects. And so it's no surprise, particularly for food and nutrition policy and food and nutrition initiatives, that California is a natural leader. You know, first and foremost, it's one of the largest food producers globally. And so its policies, it has served as a natural leader in agriculture, and it's a pioneering force in progressive food and nutrition policies. So looking from that agricultural lens, California contributes over 13% of the nation's total agricultural value, right? So producing a wide variety of crops, including almonds, grapes, lettuce, and strawberries. That's obviously not only crops that we produce here in California, but we are quite, you know, quite diverse, at least in the variety that we do grow here. California leads the US in production of over 50 crops. Some examples include also avocados, artichokes, and tomatoes. Agriculture in California supports over 1.2 million jobs and generates 50 billion annually in revenue. So that's, you know, those are pretty significant. I'm not saying that that means that we are the best. There is a lot of work that I'm not even going to get into that needs to be done around, you know, farm workers' rights, conditions, also the access to you know, foods for those communities as well. But in general, agriculture, California is a strong leader and always has been agriculture. Our climate and just the way that the state is and how much it spans provides a lot of unique systems to be able to grow a different types of foods. Right. Also, California has been very innovative in farming practices. I know I mentioned this a little bit earlier. California has adopted sustainable practices, you know, from drip irrigation to integrated pest management. It's also home to largest number of certified organic farms in the U.S., and that's not even including the ones that are non-certified that are still organically grown farming. And again, there's just multiple other farming practices that California has become much more of a leader in supporting and providing, you know, a pathway to continue the development of farming practices, different farming practices that be more sustainable and potentially even increase the nutrient densities of the foods that are being grown and sold, produced. All right, thinking about the policy side. So I know I mentioned already some of these. I'm not going to go into detail of all of these, but progressive policies are often that we hear kind of big nationally have often been piloted in California, where California is one of the like pilot sites for a national initiative, and more often than not have been serving as models for the national adoption. So we're going to talk about school meals here in a bit, as well as the food as medicine initiatives. But some of the other ones that come up that I'm happy to mention are the Healthy Soils Initiative. So this was an initiative that aimed to improve soil health through grants and support for farmers adopting regenerative agricultural practices. Again, I think I might be speaking to the crowd, the audience for this group here. Also, I mentioned the food waste reduction laws. This was another bill, Assembly Bill 1005, that mandates that surplus edible food be recovered and distributed to food banks, addressing both food insecurity and waste management. This went along with the other Senate bill. And then equity and smallholder support, I mentioned a little bit. And then here's that healthy store refrigeration grant program, again, to help really support those establishments that are located primarily in a food desert, which is everybody here familiar with what the term food desert means? I think, okay. Has anybody ever heard the term food swamp instead of food desert? Yes. Okay. I see some maybe. So as kind of a quick food desert, if you think about desert, not a lot of options for being able to have access to foods and healthy, nutritious foods. Or food swamp, on the other hand, means that there is a surplus of access to foods, but perhaps not the healthiest, nutritious, culturally appropriate foods as well. So that's where sometimes you hear both of those terms that can be used. All right. All right. So I know I mentioned this kind of before, like, although California is amazing and great in terms of a lot of the initiatives that it leads and kind of really being a trailblazer for many of these progressive policies, as well as continuing to be, an agricultural powerhouse, it still faces a lot of significant challenges. And again, thinking about that food and nutrition policy lens, there's still a fairly prevalent amount of food insecurity in the state. According to the stats from last year, almost a quarter of California households experienced marginal or low food security in 2023. So that means that there was at least some food insecurity that was reported within the last year. You can see down here, although the majority of Californians reported as being food secure, there was this quarter of Californians that did not report that. And that is about the same as what the average US average is. So again, not necessarily worse than the national average, but the hope would be that we are continuing to decrease our food insecurity rates. So that's something to keep in mind, when we're thinking about trying to build these policies around addressing food insecurity, needing to promote access. We have a very large state. We have a very large diverse population that lives in California. A lot of different unique needs, a lot of different intersections and different food systems that are overlapping or even butting up next to each other. And so it is also a very constantly changing climate. We know that there's a lot of other factors that go into and can impact things like food security and equitable access. We haven't even talked about housing, cost of living, or what have you, but all of those things, they're not all in their own separate cylinders. They all intersect and are overwoven together. And so again, although today is a more focus on the food and nutrition, really that is one piece to a larger web of different factors that we're working together and thinking about policy. So once you get your head wrapped around coming up with a food and nutrition policy, then you have to take a step back and think, how does that apply or fit into a larger, maybe what's the word for it? A larger initiative to meet not only the food and nutrition needs, but also the housing needs or the other security needs of the populations in which you're trying to serve or meet the needs of through these initiatives. So there's still work to be done, which I would not expect anyone to be perfect, and especially with the ever constantly changing landscape, physically as well as maybe politically, things are going to change. All right, so what is going on with currently with California's food and nutrition policy landscape? So although there are multiple food and nutrition policies that have gone on with California, I'm going to highlight childhood nutrition and food as medicine as kind of our bigger focus today, mainly because from a dietitian's perspective, these are very integral, not only to my pediatric nutrition and pediatric dietitian lens, but also I have children myself, and they go to school, and many of these policies not only are impactful on the California scale, but can also be seen on the national level as well. And so the thing with policy is we oftentimes are thinking or might see or hear things on the national level, but they also may be being run or implemented slightly differently on the state level. So being able to understand the difference between the two, or maybe the similarities, is something to consider if you are when you are kind of diving into your own policy and food and nutrition interests. All right, so here's where I want to talk a little bit more about the Universal School Meals Program. So this is a big deal. So California became the very first state to offer free meals for all public school students. So, and I'm emphasizing public school students. So any private schools or parochial schools, so like religious affiliation schools, don't necessarily offer universal school meals and do not fall under this policy. So this policy is specifically for public school students. But this is still very innovative because obviously California is a large state and has some pretty large public school districts. And so being able to offer and have written into the budget to provide universal school meals is a huge deal because that is a commitment and it is obviously a cost. Food is expensive. And I'm not going to have time today to go through all the ins and outs of the childhood nutrition programs, but school food is a very unique program, and nationally, the participation has gone down. Some of it, yes, COVID related, but in general, it's gone down. But ever since implementing in universal school meals, it has gone up. So what is universal school meals? It is literally the offering of free meals, 2 meals a day, usually breakfast and lunch for all public school students, no matter their eligibility. So previously, and in certain states right now, if they're following the school breakfast or national school lunch program, students qualify depending on the parent's income for either free meals, reduced, or full price meals. And when I say free, reduced, or full price, it's how much the family would pay for that meal, but also the reimbursement rate in which the school gets back for that student participating in the program. It's different here because now it doesn't matter what the income level is of the child's family, everybody gets the free meal. So why this was a big deal? Well, in California alone, over 1 in 5 children face food insecurity. So of that quarter of the California population, those that were identified as food insecure are children as well. That wasn't just adults. School meals are critical for providing children with adequate nutrition to support growth, development, and learning. If you are someone who is, food insecure and the access to food regularly, like at home, is not stable, going to school every day and getting at least 2 meals a day of nutritionally adequate food is huge. All school meals through Universal School Meals Program, or if they're following school breakfast program or the National School Lunch Program outside of California, follow specific guidelines and to meet the dietary guidelines for Americans for the young childhood ages, or depending on the school. So for high school, because the kids are older, the requirements are slightly different because they require more to eat. But regardless, these meals are nutritionally balanced and do meet a set of standards. Prior to the implementation of universal school meals, there were several studies done, and this meta-analysis captured that a nice kind of a nice narrative to talk about and show that those students that were receiving nutritious school meals, so again, this was before universal school meals, so just looking at students that were enrolled in the school breakfast or national school lunch program, that they showed a 10% improvement in test scores and a 15% reduction at absenteeism if they compared to those who were not participating in them. The access to balanced diets through school program was linked to better long-term health outcomes in these students. And really what this meta-analysis underscored was that there is an importance of policies like universal school meals for children's health and educational success. So there was quite a building of evidence to show that these programs are serving a purpose, but there were still limitations. And by providing or moving from qualifying program structure to everybody is offered a meal, can help and, improve all children's, outcomes, health, and educationally related. One other big thing that we haven't even talked about yet is universal school meals reduce stigma around utilizing food assistance programs, heavily reduce administrative burdens, and increase participation. And when I say administrative burdens, things like having to collect money, which can impact stigma, having to follow up if there is debt, which is both embarrassing and in some instances that I've seen on the news or reports can be cruel. So universal school meals helps to basically eliminate all of that. So, so in 2022, universal school meals went into effect. A very early evaluation of the program, so kind of early, partway through 2022, it showed that 6 million public school students had access to free meals daily, regardless of their income. Those outcomes showed a 20% increase in meal program participation. So from prior to the initiation of the universal school meals, they had higher engagement in the lower income districts. So those families that had a lower income, take home income versus other districts. And the impact was that, sorry about that. Sorry, something popped up on my screen. The impact showing that, sorry, my screen just got a little crazy there. Sorry. Anyways, the impact again, really showing that reduced stigma associated with the use of free or reduced meals, reduced price meals. So there have been, since 2022 is a few years ago now, there have been multiple policy briefs taking a look at evaluating this policy on certain outcomes, as well as outcomes. When I say outcomes, not just in terms of childhood health or pediatric health, educational outcomes, but even engagement with the program. Are people actually using it? How's it being implemented and such? And so a couple of the more recent briefs, so one came out earlier this year and then one came out in March of last year, had pretty much the same, for the most part, very closely overlapping outcomes. So in the first brief, which was published by the California Association of Food Banks, they found a reduction of food insecurity in those families that were participating. So 3.8% decrease in food insecurity. And students that participated were less likely to have nutrient deficiencies. They saw increased meal participation. So despite an overall national decline in school lunch participation by more than 4%, California's meal participation continued to increase in that 2024 to 2025 years. It was projected that about 845 million school meals were to be served throughout California. There was found to be alleviation of financial strain for families, since families didn't have to worry about buying food to make lunches and breakfast or purchasing at school. Again, supporting the elimination, findings supported that there was that elimination of stigma and meal debt. There was continued support for academic success and that promotion of long-term health. In the second policy brief, which was completed not too long, or published not too long ago by the Nutrition Policy Institute, the UC ANR, Agricultural Natural Resources, NPI is located in Oakland, so we do some work with them in our department. They found that there was a very broad support across communities. 87% of students and 80% of their parents really supported the School Meals for All program. Parents reported that it saved time and money and reduced the stress. really supporting that, it's when parents favor programs, more often than not, children will continue using them. So increased participation in school meals. So we saw this, remember this report came out like about a year after the first increase. 2/3 of California food service directors reported an increased participation in school meals by 8% since the program's inception. So over the last 3 years, they've seen an increase in its use. And then the California Department of Education estimated that nearly 1 billion school meals will be served this next year, right? So for this year, wrapping up here soon, they thought about 845 million. They think they're projecting for next year that about 1 billion will be served by the end of the 2025-2026 school years. The other outcomes were very similar to the first policy brief around financial burden alleviation, reduction in hunger, and improved nutrition, stigma, and positive impact on academic performance and long-term health. I know those numbers are really awesome. It is an amazing program, and it's been so great to see so many other states starting to adopt universal school meals as well. So a couple of other childhood nutrition specific programs, the farm to school programs. So what are the farm to school programs? This is where you're seeing that connection with local farms to provide fresh produce for meals. This was started as a pilot, if I remember correctly, back in like 2008, and California was one of 8 states to pilot this. So these initiatives work on not only that connection with being able to work with local farmers to bring food into the schools, but it also focuses on nutrition education and sustainability as well. So the program awards competitive grants to support projects that will cultivate the equity, nurture students, build climate resilience, and create those scalable and sustainable change. So there was an evaluation report that came out for some of these programs. So from the California Farm to School Evaluation Group, California had made the largest investment of any state in farm to school programs, allocating about approximately 100 million over 3 years to the program alone. Funding for the California Farm to School Incubator Grant Program grew from 10 million in 2020 to 60 million for 2022 to 2023, supporting a wide range of farm to school initiatives. One of the pieces of legislation that I will be bringing up here shortly continues to support the farm to school initiatives in the California budget. Broad reach across educational agencies, 99 local educational agencies with over 1.3 million students. So about 23% of all of California school students receive direct funding from these programs. The program's reach spans diverse geographic regions to ensure that students across the state benefit from farm to school activities. Right, so there's support for local food procurement. Also this emphasis on education and environmental stewardship and focus on equity and community engagement were all found as strong outcomes in the evaluation of this program. All right, moving on now to the food as medicine initiatives. So what is food as medicine? What is the food as medicine approach? So this is really, again, connecting nutrition and healthcare to address chronic diseases like diabetes, hypertension, and obesity. So examples of this include medically tailored meals to help improve chronic disease outcomes, also produce prescriptions and nutrition counseling to help reduce healthcare costs. And one very important thing that comes up for dietitians is medical nutrition therapy or nutrition therapy recognized as an essential healthcare service. So this is a big deal for someone who is a dietitian, especially as we are one of few states that doesn't have a licensed healthcare, that dietitians are not licensed. And so initiatives such as this help to really show the importance of my profession, as well as to help provide evidence for why we should be licensed and recognized in that sense, especially as some of these food and medicine approaches are going nationally. Trying to adopt similar language is really important, and more often than not, language includes things around being licensed. And if we're not included in that because we're not licensed, that's not great. So that's a separate policy initiative that is important to dietitians, particularly in California. But with that being said, food as medicine has been something that I know I've brought up in my public health nutrition class for years. I feel like now you're hearing it more on the national level, especially with the White House, Conference on Health and Hunger when the Biden administration was still there. And even though it's kind of repackaged as something else and maybe not 100% the same, but still some of those same elements in some of the MAHA talks and reports that are coming out as well. So food as medicine is, something that has a lot of policy implications behind it. So some California specific examples are those produce prescriptions and medically tailored meals. I bring this up just because some of this has already been integrated into some of the reimbursements. So for example, medically tailored meals, when it came out as a pilot program, and now it's trying to be more integrated into this, it is funded by Medi-Cal, and Medi-Cal is our large healthcare coverage here in California. In this pilot provided meals customized for individuals, again, with chronic diseases, and it has shown improved health outcomes for the participants in those pilot regions. There have been a few policy briefs and reports on the produce prescription programs, as well as food as medicine. Just for sake of time, I'm not going to go through all of these ins and outs, but essentially there's been a lot of benefit and momentum to continue to implement and have funding to support these programs and initiatives into the healthcare setting. So here's another, I'm going to bring up one study specifically for food and medicine, a really recent one that a colleague of mine just published, and it was looking at one of the food as medicine programs here in the Bay Area. I believe there it is right here. I'm not sure if anybody here on this call has ever heard of Recipe for Health, but the Recipe for Health program is a 16-week multi-component food as medicine intervention designed to improve behavioral and mental health outcomes among patients with diet-related chronic diseases. They were looking at the differences between food secure and food insecure individuals. So this was an intervention study. They had 336 adults that had diet-related chronic diseases or food insecurity, weekly deliveries of fresh produce to these individuals, and they had behavioral health sessions. So they used the 6-item food security survey to assess food security status throughout the study. And they also did measures of fruit and vegetable intake, physical activity, and mental health indicators to take a look at changes before and after the intervention. Some key findings included that 96% of those that were in the study had one or more chronic conditions. So chronic conditions being anything from heart disease, high blood pressure, diabetes. 62 of those that participated in the study were identified as food insecure, so over half. Behavioral outcomes, food insecure participants saw a significant increase in their intake of fruits and vegetables. They saw a significant increase in their moderate to vigorous physical activity. And this was not seen in the food secure participants, specifically primarily in the food and vegetable intake. For mental health outcomes, both groups experienced significant improvement with loneliness, anxiety, and depressive symptoms. And then there were some between group differences. Let's see if I can see this. Hold on one second. There we go. Those that were food secure did show greater improvement in anxiety symptoms compared to the food insecure participants. So in conclusion, the Recipe for Health program did demonstrate positive impacts on both behavioral and mental health outcomes, particularly for those who were identified as food insecure. Findings suggest that incorporating food insecurity as a qualifying condition for food as medicine could enhance the reach and effectiveness. Right, so there have been a lot more initiatives and policy briefs out to really expand the food as medicine initiatives into healthcare, as well as getting reimbursement coverage for them. There have also been some legislation that have unfortunately not gone on, but have continued to be brought up and keep getting closer and closer, which is what I was going to share with you all next, was what have been some recent as well as current legislation that is relevant to the California's food and nutrition policy landscape to meet some of these initiatives. So a couple of childhood nutrition and school food policies. Both of these, AB 675 as well as Senate Bill 411, have both been introduced into the Assembly and the Senate, and they both have come out of one or at least two committees and are moving forward. Our organization, the California Academy of Nutrition Dietetics, I helped write support letters for both of these, and I've met with the office staffers of these of the Assembly and Senate senators that sponsor these pieces of legislation. Right. There's a more newish one out that came out looking at ultra processed food bans in school, and this one is proposing phasing out harmful ultra processed foods from California public school meals by 2032. There's a few key items in here around not just taking them out completely, but also working on defining what are harmful ultra processed foods. As for anybody who has been in this space, I am not that's not my research, but it's there is no universal definition, and depending on who you talk to and what set of indicators or definitions you're using, your how you define an ultra processed food, it can be some different. So part of this legislation is to help with defining that. So these are the two pieces of legislation that unfortunately failed, or this one, AB 1975, was vetoed by the governor. This one would have made medically supportive food and nutrition interventions basically like a covered benefit under the Medi-Cal program from here on out. It made it through both sides of the Assembly and the Senate, and ultimately was vetoed by the governor, which is unfortunate. Not so much, it sounds like, that he's not in favor of medically supported food, but with this one, there was quite a financial cost. And that is something that does come up. And Mia Bonta was the lead on this bill. And unfortunately, and she also helped lead this bill down here. Unfortunately, she's not introducing one for this legislative session, we have been told, but hopefully in the future, there'll be more momentum. I have a lot of friends that are still writing and rallying around 1975. Let's see. Let me go back one more. Sorry about that. Claire gave me the okay that I can go over a little bit if I need to. Thanks, Claire. A couple of food access, equity, and local food systems. This SB 444, I think, literally came out yesterday. I was updating these slides and saw that this one was brand new. It came out, so I wanted to include it in here since it does fit right in with building the our equitable and sustainable food systems. And then we did actually have an executive order that the governor issued earlier this year around healthy food access and ultra processed foods, which is likely what this piece of legislation, the AB 1264, stemmed from in response to that. And then finally, we did have a, I am blanking on what SJR stands for. It will come to me. It'll come to me at some point. But anyhow, we do also have protection of the Supplemental Nutrition Assistance Program. So again, in California, our SNAP is called CalFresh, but this is urging, at a national level to avoid any cuts. And that is, I know, again, I've been focusing with this strong California lens, but SNAP and programs like WIC are federal. So if their budgets are altered or changed at the national level, that does mean that can trickle down to the state level. So yes, Senate Joint Resolution. Thank you, Claire. I could not remember what that was. That's what SJR stands for. So anyhow, going back to that. So again, it's where I say it's important to think about, yes, our state policies, but also those federal policies that may impact how we're able to implement our state policies or programs. And then going forward, and yes, Jenny, that is a great question. I will send this to you in just a second. Some just general guidelines that I kind of came up with in terms of like how I would envision designing equitable and sustainable food systems based on that food and nutrition policy lens, and kind of combining my research, background and clinical background, and just meeting all of those needs. So I think it's always good to kind of take a step back and think, what, like, if my overall goal is designing an equitable and sustainable food system, like what does that mean, or what would that look like? So what is equity in a food system? So equity in itself and in a food system is saying that we're hoping to ensure that everyone, regardless of socioeconomic status, race, ethnicity, geography, or other factors, has consistent access to sufficient, safe, and nutritious foods to lead a healthy life. So it's not just about providing equal resources, but addressing those systemic disparities to help achieve fairness, right? So when we break down equity, what are we hoping to address? Access, representation, and fair labor practices to help build a more equitable food system. So looking at it from the lens of sustainability, sustainability is focusing on creating systems that can meet current food needs without compromising the ability of future generations to meet theirs. So integrating environmental health, economic viability, and social equity into all facets of food production, processing, distribution, consumption, and disposal. So the whole, food system cycle, right? So principles that we need to think and address are going to be around environmental protections, economic resilience, and social responsibilities. And then this is one that I bring up because oftentimes when we're thinking about, access, we think about food insecurity, and we think about, I can even go back to this right here, we're looking at some of these factors that are not necessarily medical. So we are looking at, the social determinants of health. So these non-medical factors, though, that can influence health outcomes. And I am barely bringing up the social determinants of health, or sometimes the social determinants of health and disease, but social determinants are something that should be always constantly integrated into thinking about how we're providing care, from a clinical lens, from a research lens, from a multiple level lens, because it's these social determinants of health that are causing these, that are certain, let me see if I'm putting this in the right way. These different factors can either increase the disparities, causing a disparities between one outcome versus another. So those are health outcomes. And so we want to focus our policies or programming to help narrow that disparity, knowing that some are unfortunately inherently there. It could be because of, multiple reasons, but the hope is we are, designing a policy to help build a food system that would shrink that disparity down so it is not there. So in food systems, what would these include? Economic stability, being able to purchase food, so cost, education, understanding, nutrition literacy and awareness of food choices, especially when we have so many different influences and factors that influence our food choices. Our access to healthcare, so preventative and treatment services to help with diet-related diseases, neighborhood and environment. Claire probably will remember quite well my whole lecture on where you live affects your health. And if you go and you Google up zip codes and like long life expectancy, you can put your zip code in on where you grew up or where you live now, and you can get there's a algorithm to determine how long that you are expected to live in that neighborhood. And then also social and community context. So food security can be shaped by social support networks and systemic inequities within those networks. So all of these are interconnected and contribute to disparities in food access as well as different health outcomes. And again, they disproportionately affect low income and minority populations. And so that's why it's important when building these that we are addressing them. And then thinking about food justice and the intersection of equity and sustainability. So as we know, food justice seeks to dismantle these systemic barriers that perpetuate these inequities in our food systems. So we want to advocate for practices that are sustainable and serve those communities. So what does that include, or what would we be focusing on when building out a equitable and sustainable food system? Land access, right? Fair food economies, and cultural relevance. All right, so when thinking about California, all right, California, as I mentioned, has its challenges, and it's a very, very diverse demographic. Urban areas, rural farm worker communities, more, sprawl. We want to make sure that we're ensuring all children, regardless of income or location, have access to healthy food. Like just some basics, thinking again about, maybe a couple of the lenses examples I gave. Here are off the top of my head some examples of things that we could do, again focusing on that policy. Advocating for universal school meals programs, so the continuation of what we have now, as well as building on and maybe offering free meals for all public school students, for the public school students and beyond. So maybe some of those other school systems. Also, maybe thinking about adding on other parts. Not every school does breakfast. Sometimes they do lunch and they do a snack. Maybe we can make sure that there's more than there's just breakfast, lunch, and a snack, or combining with some of the other federal food programs that we have. Looking at extending eligibility policies around expanding eligibility for CalFresh, expanding some of our other initiatives that would be meeting these needs. These are all a review. Oftentimes we get very excited about policy. We get excited about making changes, and we forget that the policy making process and just how government works in California and at the national level, there is a process. There are multiple players that we are interacting with and engaging with to hopefully move our initiatives forward. And so this just reminds everybody of how government works, and that there are multiple steps along the way to get from when we express a concern all the way to it actually becoming a law. And so when we think about where to engage at every step of the way, there are opportunities to engage to help move forward initiatives. So kind of in essence, kind of to wrap up, things that I would say to focus on based on just my small lens and focus for today: community-based solutions, child-focused programs, and food as medicine integration would be kind of my top 3 policy areas to focus on, to integrate in, to build equitable and sustainable food systems here in California, knowing that there are already some existing programs that have some really positive outcomes in terms of just policy implementation and health related outcomes as well, but there is much more room for improvement. A lot of them are maybe at the pilot level, so really expanding. So your take home message, thanks for hanging with me for those that are still on the call. There are challenges in California's current food systems, right? There are inequities in food access. There's environmental degradation. There are health outcome issues, right? So we need to be, very cognizant that there are challenges, and they're going to always continue to be challenges. And so we're going to be having to flex and be dynamic in how we want to approach these problems. And not every population or food system is going to be affected in the same way. Where to place the priorities for building equitable and sustainable food systems, focusing on health, social, economic, and environmental areas, right? You want to make sure that we're meeting overall health goals, promoting dietary shifts, towards a, maybe healthier eating dietary pattern, like thinking about more plant-based or minimal processed food, whatever the outcome goal is. What are the social goals that we're meeting? Increasing community participation in food policy decision-making, supporting local and regional food systems to strengthen that economic resilience, and thinking about our environmental goals, addressing climate change, reducing greenhouse gas emissions, thinking about our farming practices and policies that would be supporting those, or maybe, fighting against some that may not be, supporting that equitable and sustainable food system that we're hoping for. And so strategies for achieving this, okay? Policy innovation and reform, really thinking and developing cross-sectional policies, expanding on current policies that will simultaneously address those health, economic, and environmental objectives, right? Engaging community members, engaging diverse stakeholders, especially those from marginalized groups, and have them be a part of the decision-making process, right? Those communities are going to be able to speak to what is going to be most effective in helping to, meet those health goals, alleviate those disparities, right? Or address those disparities. Utilizing evidence-based research to measure the long-term impacts of food systems on public health and environmental sustainability, and cross-sector collaboration, right? Collaboration is key. Strengthening partnerships between government, private sectors, NGOs, community organizations, individuals, what have you. Partnerships are going to be key because everybody plays a role within a food system. Everyone plays a role in the policy making because everybody is impacted by policy. So with that being said, I have the next several slides or different resources of, getting more involved or getting more information around policy innovation or reform, and community engagement, data and research, basically going across all of those different opportunities or ideas for change. To answer the questions, Maria, I know you had a question first from back. You do have to go. Absolutely, you're more than happy to find me on LinkedIn. It's just under Mary Lesser. Thank you for attending today. To answer your question, please check out the resources, but also when you connect with me, I can tell you, start talking to your local, your local representatives, either, at the, town, city level, your city council representatives, to even who your assembly member or your Senate representative is. All right. Jenny, you had a question about where to go to be tuned in with relevant policies. You mentioned polling this morning. Can you share the link? So for me, there are multiple different listservs that I'm on that I get updates about things from. A couple of, as part of the organization that I'm in, I have a couple of members of my policy council that kind of put together different bills and such. But one of the things that I would say is, oh gosh, I can't think of what the name of it is right now. It'll come to me. I can send it to Claire to send back to you. There's hold on one second. Let me look her up. It is, I have a previous student who is at hold on one second. I'll find it for you. Nope, not that one. There's a great organization that on their website, they have continuous updates of different legislation that's food and nutrition policy specific around both the national and California levels. It will come to me. I can't think of what the organization is right now, but I can send it to Claire. Yes, Civil Eats is also a great food policy tracker. There's quite a few out there. I know Center for Science and the Public Interest usually has quite a few briefs that come up. If you follow the Nutrition Policy Institute, that's the UCANR, and you can sign up for free for their listserv. They will send out policy briefs where they basically, or they call them research to policy action, where they basically condense down all of the recent research that's been going on in certain policies and then show how it's been put into action. Another great resource for anybody who is interested is oh my gosh, why am I blanking out? Probably because I haven't had not enough coffee today. They have the Healthy Eating Research Group through, oh my goodness. It's a collaboration through UCSF and it used to be Duke University. I can look up that one as well. I'm happy. Yes, that's it, Clara. Thank you. Thank you for just reading my mind. Yes, Noprin. nutrition, obesity, now I can't remember what the PREN stands for, but the Healthy Eating Research, the No Print group through UCSF is excellent. As well, you can join in. They send a bi-weekly research newsletter as well. And then I think I've got one more question. What do you wish more people, consumers, knew about food and food policy? What should lay people be paying attention to enable a healthier food system? This is a great question. I wish more people knew to take a step back and just anything that comes over on the news, just don't take for face value, and to just start asking questions, and to really think through like why things are done certain ways and start to question it. Just, why, like, several years ago when like the soda tax or the sugar sweetened beverage tax was up, why were people fighting against it? Why were people for it? Like, how does it impact you? So just really taking a step back and asking yourself when you see these, initiatives come over, just thinking to yourself, how would that impact you? How would that impact your family? And those sorts of things. Thank you, Claire. That's exactly it. When I say more about the news, yes, there's just so much that comes over these days. And when I say comes over these days, on the news, on social media, just, even like just passed around even for fun, that it's really hard to tell at face value what that actually means. There's a lot of panic headlines out there. And so taking a step back to really like evaluate what's being said and not being said in that article, or even taking a look when they say, oh, this was the study that was cited, to actually go look at the study and practice reading through to understand what does that data really mean. Because unfortunately, more often than not, it's a slight misrepresentation, not maybe necessarily on purpose, but that's just because it's really easy to hone in on like the, couple of sentence conclusions and results versus actually going through the paper to understand like what was the question that was being asked and what did they do to try to answer it, because that will tell you a lot more about what those findings really mean. So practicing those critical thinking skills. And also we're on like information overload. So like trying to take the time to carve out to read through things when you're not being blasted by 100 different emails, or in my case, small children or what have you. So anyhow, these were great questions. I'm going to stop sharing my screen now, go back over here so I can see you all. But anyhow, I really appreciated, the opportunity today. I know I went way over. I'm so sorry, Claire. But I'm happy. Hopefully this addresses generally the topic, hopefully not too much in too much detail, but I'm happy to answer any other questions. Feel free to reach out to me. I think I can't remember, I included my email on this whatchamacallit in the slides, but I can also drop it here in the chat. But I'm happy to connect offline as well. So I guess that's it for today. So thank you, Claire, again for having me.
Oh my gosh, thank you so much. This was just such a rich and detailed presentation, and I really do feel like I always walk away from a conversation with you feeling like I've learned something. So I can't thank you enough for joining us today. And yeah, thank you for all who stayed at the end. And this will be on our website and our YouTube as a recording. So if you want to go back and see these things, and if you want to reach out to me to get to Mary as well, like you can find me at the program's email. But thank you so much. This was amazing. Have a great day.
Awesome. Yeah, thank you all.
Thank you so much.